blood alcohol concentration. So first we are looking at the 0 to 50%. In case of 0 to 50%, there is no significant or mild euphoria. So you can say there is no significant as well as there is presence of the mild euphoria. Next we are looking at the 50 to 100 mg percent. So here we have there is decreased inhibition and as well as increase in self-confidence. Increase of the self-confidence. There is also decrease in the attention span. There is the slurring of speech and alteration of the judgment. And there is also presence of the nystagmus. Now moving ahead to the 100 to the 150. So in case of 100 to 150, what is seen is there is more kind of confusion. There's mental confusion. There can be the emotional instability, as well as there is the critical judgment. It affects the critical judgment. There's complete loss of the critical judgment. They can also present with the ataxia. There is also the impaired memory and presence of the sleepiness. Next we are looking at the 150 to the 300%. 150 to 300%. So here what is seen is there is loss of muscular coordination. Next there is also the staggering gait. There's presence of the drowsiness, as well as there is the exaggeration of emotions. There is also the dizziness present, disorientation and decreased pain response. So the decreased pain response is seen in case of 150 to the 300, as well as presence of staggering gait and as well as presence of the loss of the muscle coordination. Everything happens at 150 to 300. Whereas when we saw 100 to 150, we had the basic mental confusion. There's also loss of the critical judgment, which we saw, and there is impaired memory. In case of 100 to 150, there was memory problems. Impaired memory was seen. Previously, when we saw 50 to 100, what was seen is there is decrease in the attention span, as well as the slurring of speech. Slurring of speech starts immediately at 50 to 100. We saw the slurring of speech. Now moving ahead, we finished till 150 to 300. Now going to the 300 to 400. So in 300 to 400, what we see is there is stupor. There's stupor as well as there is marked in coordination, and there is possibly a coma that is seen. Next, moving on, in case of the 400 mg and above, in case of 400 mg and above, there is presence of the anesthesia. There is also decrease in the response. There is presence of the respiratory failure and deep coma, as well as presence of death. So to recap what we saw the blood alcohol concentration, and they are classified as 0 to 50, 50 to 100, and 100 to 150, and 150 to 300, and then 300 to 400 and greater than 400. And then we saw their respective effects.